In this video, I'm sharing the two main reasons why a deadlift continues to hurt your low back. If you're new here, my name is Dr. Brian Larish, and I'm the owner of a cash-based physical therapy clinic, as well as the creator of the PT Growth Academy. Now, the deadlift is the easy exercise to blame whenever we're dealing with some sort of low back pain. By the end of this video, you should have a clear knowledge base as to why it's hurting your back and what you should do about it. So to understand how the deadlift is hurting our low back, we need to understand the why. And that brings up the biomechanics. But don't worry, it's not going to be anything too crazy, and I want to put it in a way that hopefully makes sense. So when it comes to a deadlift, we are trying to move horizontally. That's this way. A squat, for example, is more vertical. So deadlift, horizontal, squat, vertical. But the shape of the pelvis is what starts to dictate the ability to deadlift correctly. So a pelvis that can go through a good deadlift that probably doesn't hurt the back is one that is internally rotated, adducted and extended with a sacrum that is nutated. Now, if you're not in the physical therapy world, the strength and conditioning world, don't worry. Here's how I want you to think of it. I want you to imagine a locked door versus an unlocked door. The door is representing the posterior lower pelvis. So we're thinking muscles that are here. So the glutes, the piriformis, the external rotators, all the muscles back here. If you have an unlocked door, that is when the pelvis is more internally rotated. And as you can see, it actually opens up a bit. And so this represents muscles that allow the pelvis to move. And in the movement world, it's known as eccentric contraction. So the muscle can lengthen as it contracts. Conversely, a locked door at the posterior lower pelvis here is when the pelvis shape is more here. And so now we're more compressed and the muscles aren't allowing that elongation to occur. Okay, so we have unlocked versus locked. So imagine my hand is a door, and I told you that you had to push through the door. And if you want to, feel free, jump up and go through this activity, and it will start to make even more sense. So my hand is a door. As I'm pushing into the door, if the door is unlocked, I hit the door opens, and I continue moving that way. That is moving horizontally because we have an unlocked door here. So we have muscles that are allowing us to move through that direction. Conversely, if we go ahead and lock the door, if my hand's the door, we push into it, we meet the door, but this time it's locked, so it doesn't open. Instead, it stays right where it is. What does the pelvis have to do? The pelvis has to change positions, and then it's going to slide down the door because the door is not budging. It's locked. So what does that look like? This looks like a squat. So the door, when it's locked, we squat. When it's unlocked, we hinge or deadlift. So that's how I want you to think of the biomechanics of a deadlift. We want to move horizontally, and we want to be able to move the entire range like that, not start horizontal and then switch to vertical. That means we're hitting a constraint. Now, why is this all important? Well, it's important because the first reason as to why you have back pain from a deadlift is because your structure, your body type, biases an unlocked or a locked door. The shape of your pelvis, the shape of your rib cage starts to dictate how you move, meaning we're good at certain motions and we're not so good at certain motions. So the first reason why your low back hurts when you do deadlifts is because of your structure. If your structure is more biased in internal rotation, aka an unlocked door posteriorly, it's usually associated with a posture that's a little bit more shifted forward with a pelvis that tips anteriorly. These individuals are usually better at deadlifting. So if you're the opposite, if you're locked posteriorly and we're a little bit more here, it's going to be challenging to deadlift. You're going against the grain to begin because your structure doesn't want to unlock. So when we start to go into that hinge, we usually hit that locked door and go straight down. So what does this mean? This means that you're going to have to compensate. So if your structure has a locked door posteriorly, you're usually going to compensate, and that's probably why your back is hurting. If you have a structure that is more internally rotated, which is the unlocked door, you probably have an easier time getting down into a hinge and moving horizontally. But that's just step one. Step number two is that we need to be able to have the right technique. And more specifically, we need to be able to produce force the correct way. This is the second reason why your low back is probably hurting during a deadlift. So before we get into the technique for our number two reason, let's first jump back to number one. We said that the structure limits the movement capacity of actually hinging. So if this is your structure, here are three things we can do to try to fix it. Number one, the deadlift might not be a best exercise for you, and that's totally fine. So we want to consider that. Does a deadlift align with our goals? Maybe, maybe not. Just depends on what you're looking for. Number two, we could change the exercise setup. So we could switch out a barbell for dumbbells or a trap bar. And number three, we could start to make modifications such as raising the floor and start changing the depth of range of motion to hopefully going through a range of motion that you can capture without compensation. But just know that if your structure has a little bit more of this type of bias, has a rib cage that is more narrow, it's ultimately just going to be harder for you to deadlift. But don't worry, it's going to be easier for you to squat. All right, now let's go back to the second reason, and that is that you may have the capacity to move in and out of a deadlift great, but your technique might not be great. And more specifically, we're talking about how you develop force. We need to be able to put force into the ground without compensating. This is a very detailed topic, but I want to go through a couple of key things and just an overview of a deadlift so that way you can start to implement it. So when it comes to a deadlift, we want to think about that we are pushing the floor away from us, not pulling the bar up. Pulling the bar up is going to do just that. We're not going to push down, we're actually going to be pulling up. And so from a foot contact perspective, we're not going to have the right shape that's needed. We need a slightly more pronated foot, a foot that goes down, an arch that drops, so that way we can push into the ground to actually lift ourselves up. And so when it comes to doing that and understanding that, we want to think about taking the slack out of the bar. All bars are going to have slack. That's it. And so if we don't take the slack out of the bar, when we go to stand, the bar pushes down as we're trying to go up, and usually the spine is going to be the breaking point. Not literally breaking, but that's going to be the compensation point, and then we start to have low back pain. Remember, a deadlift and really all exercise as a whole should not cause low back pain. And so we want to take the slack out of the bar. How we do that is when we're in this position, we're pulling the bar through a little bit of scapular retraction. We're not using the biceps. We're not bicepping it. We are getting that tension through the shoulder blades. And here's the thing. Getting that, step one. Step two is when you go to stand, not losing it. Anyone can get the slack out of the bar. But as you start to stand, so many people lose that slack, and it's really easy to know if you did. What happens is, as you stand, you'll hear a click. It sounds like this. You'll hear that. What it should sound like is absolutely no noise. Take the slack out of the bar. No noise when you stand. That is taking the slack out of the bar. What does that really mean when I say take the slack out of the bar? That means we are pushing down into the floor, and we're not losing that push as we actually then go to stand. So a really critical step to any deadlift and to any setup when it comes to a deadlift. Putting force into the ground, taking the slack out of the bar. If you have the ability to hinge and get there without compensating, this is where we want to think next. Am I putting force through the ground the right way? So I hope you found this video helpful, especially if you have low back pain. Quick recap, 2 things we want to think about when it comes to low back pain from a deadlift. Number 1, what is our structure? Is our structure the constraint? Are we just not able to change the shape that is necessary? And number 2, if we can change the shape, are we not putting force through the ground appropriately? Now, if you're a coach, a physical therapy student, or a physical therapist, and you want to really learn how to coach this and understand the biomechanics, then I would invite you to check out the Clinical Coaching Specialist certification. I'll leave it in the link below so you can learn all about it. And if you are a patient or someone that is not in the movement world and you're dealing with low back pain, or you're dealing with something else and you want to start moving pain-free, I will also leave the information below from a virtual coaching side of things. I have clients that I actually work with all over the world, and I would love to work with you. I will leave that information below if you are interested.